Okay, the fifth type of selection bias is said to be Berkson's bias. This Berkson's bias is a bias which could happen in case control study design only. In case control studies, which are carried out exclusively in hospital settings, they are subject to selection bias, which is due to or attributable to the fact that risks of hospitalization can combine in patients who have more than one condition. That means Berkson's bias will happen when, for example, if you take the cases from the medical ward, the cases are taken from the medical ward, maybe cases with cardiac condition. Cardiac condition could be taken as a case, taken from the medical ward. And you plan to take the controls from the surgical ward. Your plan to take the controls is from the surgical ward. But a patient which is considered as a control in the surgical ward could have more than one condition. The major condition which could lead the patient to be admitted to the surgical ward is the surgical condition. But on top of the surgical condition, the patient is having a medical condition. Similar with cases, maybe a cardiac condition. In addition to the surgical condition, the patient is having a cardiac condition. So that the controls and the cases will be the same in terms of the outcome. So that will be underestimation. If you make an association between the exposure and that of the disease finally, you will wind up there is no association between the exposure and the disease. That is because of Berkson's bias. The controls which will be taken from another ward within a hospital could have more than one condition, and that additional condition might be the same as that of the cases. You see? So when we are doing a case control study design exclusively in hospital setting, we need to check whether the controls have more than one condition, and we need to check that additional condition whether it is similar or different from the cases. Otherwise, if we do not check these things, a Berkson's bias will be happening. And then the effect of Berkson's bias is underestimation of the association of the exposure with the disease status. Sorry. Okay.